So this study is a substance abuse intervention for alcohol misuse and prescription drug misuse. We know that there's a lot of evidence in other populations. It works for college campuses, it works for emergency rooms. There's a lot of evidence that supports that. It's never been studied in a military population, in a National Guard population. So we're taking that and we're modifying it to be a web-based program. Because the National Guard is dispersed completely across the state, they're not centrally located on any kind of military base. So they're at a disadvantage in that sense that they don't always have resources available to them the same way that active military do. So they often live in geographically rural areas. They don't always have a VA right down the street from them that they can go to. Sometimes it's, especially when you get in northern Michigan, it's very far for some of them to travel to even a VA. There's not a lot of community resources available to them. We're taking this evidence-based treatment and we're modifying it to be web-based so it can be distributed to anybody, anywhere. And we're going to test that out and see if it works. We're also adding the element of peer support to that. So there's a booster follow-up as part of this particular program. Some people get that web-based, other people get it delivered through the use of a veteran peer. So we're sort of, investigating both of those options. Our work may impact care for veterans eventually through collecting data through National Guard soldiers, learning about substance abuse patterns in the National Guard, learning about suicide rates, different elements of suicide risk in National Guard, and learning how the two of those interact with each other. We may be able to eventually learn those patterns and develop different intervention strategies, different prevention strategies, and collaborate with the National Guard in different ways that we can keep soldiers the safest, both in terms of substance abuse, substance misuse, as well as suicide. Our collaborative partner for certain is the Michigan Army National Guard. They have been absolutely fabulous to work with. We have support from leadership at all levels with them, from the company level leadership all the way up to the state level leadership. The leadership has made a world of difference in terms of us being able to do this research. They support this program fully. They're so invested in the well-being of their soldiers. It's so great to see just genuinely how much they care about their soldiers and how much they want good things for them. They generally care about the data that we're collecting. They want us to have access to their soldiers, and they've been very good at, allowing us access to their soldiers in ways that I think a lot of people don't. They're surprised that we just have so much unfettered access to the soldiers. It's been really, really great. I've worked with veterans for over a decade now, but working with the actual National Guard soldiers has been probably the most rewarding thing that I've ever done. They have given so much and sacrificed so much for us, and getting to go out into the community and work directly with them face to face and see them and offer them treatment options and referral options, and being able to offer them resources that they might not know about. We're learning about different things that they're struggling with, and we know referral sources for them for those things. So being able to directly impact their lives that way, providing suicide intervention for them when necessary. This is a suicide-related study. We screen for suicide. So, when people screen positive, we directly intervene with them. And being able to do that and knowing very personally that I have directly impacted somebody's life by simply just asking them, are you feeling suicidal, and then dealing, with their responses, and that is so incredibly rewarding. And then hearing the feedback that they provide from participating in the program, or just having somebody that's been willing to ask them these questions. They're like, nobody's ever really cared to ask me that, or nobody's just directly asked me that before, and it's the most incredibly rewarding thing I have ever done. It's so humbling, and it's so amazing to be part of something that you get to feel like you're in some small way giving back and thanking them for their sacrifice.